Why? Let's talk to Tom Savidge, our friend there at the American Institute for Economic Research. Tom, good to see you here. So I want to start with this. Jake Sherman there at Punchbowl, he has this. He says this is massive news. The Senate Parliamentarian has struck a whole bunch of critical health provisions from the reconciliation bill, including the provider tax framework. If you could, and I know this is somewhat arcane here, when talking about Medicaid and Medicare, what is the provider tax framework?
So it starts out with Medicaid, and Medicaid is uniquely funded. Medicaid is funded by a joint match of federal and state dollars. And so you have traditional Medicaid, which is what the program was originally designed as. And that matching rate for the federal government ranges anywhere between 50 to 70%. Now, when you had the Affordable Care Act come in, it created the expansion group, which were a number of people who were previously ineligible to enroll in Medicaid because their incomes were higher. But the federal government reimburses states at higher rates. And so right now, that reimbursement rate is 90% federal funding, 10% state funding. And when it was originally passed, it said the federal government would cover 100% of the expansion group. And so states rushed to expand Medicaid and prioritize those folks in the expansion group to the detriment of those in traditional Medicaid, the poor, single mothers, things like that. And so when you're talking about provider taxes, states want to maximize that federal matching, those federal match dollars as much as possible. Okay. So what the provider tax essentially allows is that the state will tax a care group, a healthcare provider, and then have those taxes count towards Medicaid spending, and thereby inflating the Medicaid spending and increasing the amount of federal money that's coming into the state. And so it's kind of a money laundering scheme.
Oh, wow. I want to put up the Senate Parliamentarian. Her name is Elizabeth McDonough. You see her there. She's been the parliamentarian in the Senate since 2012. And I think a lot of people are asking themselves, some of these kind of outside bystanders to this entire process, what empowers the parliamentarian to strike pieces of bill text that don't corroborate or correspond to some type of number? And we can get into this. Obviously, she's unelected. Some Senate Republicans are calling for her firing over this. And let's put this tweet back up from Jake Sherman. These are some of the core tenets with regard to the Medicaid question that she has struck. You see there the immigrant Medicaid eligibility, also the expansion of FMAP for certain states, providing payments for health care furnished to certain individuals, spread pricing in Medicaid, prohibiting federal Medicaid and the CHIP funding for gender-affirming care, and others here. The Senate Parliamentarian saying you can't add those in. Why not, Tom?
So essentially, the one big beautiful bill is what we call a reconciliation bill. And that is a bill that allows Congress to push budget items through an expedited process. So not through the normal budget process, through an expedited process. And members of Congress have been huge fans of this. We've heard time and again, it seems like it happens almost every year, where they are running into the 11th hour to pass something, and it's one of these reconciliation bills, right, where they are doing things in the 11th hour. But of course, our legal system, you have to think of it as processes, not outcomes. It's focused on processes. Given that you have these expedited bills, there are guardrails of what you can and can't do, and that was the basis for the parliamentarian striking down those certain provisions, which of course it's a disappointment to see, because closing that provider tax loophole would really help Medicaid spending and ensure that it doesn't get, the folks that really need it don't get crowded out, and that these systems don't end up bankrupting not just the federal government, but the 50 state governments as well. Okay. And so really it's kind of at the fault of Congress trying to rush things through at the 11th hour. Think of a student trying to get that paper submitted by 11:59 p.m. Whereas if they had gone through the normal budget processes, they would have had a lot more leeway there. But I was reading that if members of the Senate rewrite the provisions to fit within those guardrails of the parliamentarian, especially the provider tax provisions, it can go through.
Oh. So I have to ask this. There's been a lot of back and forth. I've been asking so many lawmakers on here, reporters who cover Capitol Hill who come on here, whether or not Medicare and Medicaid are on the chopping block. After what you have seen, after this has been pending in the Senate for so long, what's your assessment? Is Medicaid going to be cut in the big, beautiful bill or not?
Well, whether it happens this bill or not, it is going to happen sooner rather than later, and it's going to happen before Medicare. Think of President Trump's promises in the campaign trail. He's not going to touch Social Security. He's not going to touch Medicare. Now, as I mentioned before, Medicaid has that unique funding system, state and federal government contributing. The federal government contributes a certain matching rate. All the federal government has to do is adjust that matching rate and say to the states, okay, you guys have to pick up a larger portion of the tab. But then the onus is on states to then they either have to raise taxes, take on more debt, or cut funding from other state spending programs to cover that gap. But it gives the folks in Washington, those politicians, some plausible deniability. They can say, listen, we just told you guys had to foot a little bit more of the bill. We never said you had to make cuts to anything else. And it allows them to kind of wash their hands of the backlash from those spending cuts. So if something is going to be targeted, it's definitely going to be Medicaid. I hope to see especially that provider tax provision get reworked and make it into the final version of the bill, because that would really help the solvency of the Medicaid program.